And today I'm going to talk about some of the refinements in thinking that I've thought about in the last few years doing fat transfer. So this is going to be more sort of thinking than technique, although there's a little bit of technique. I think you've had a pretty good foundation of technique so far. We're going to focus on, the only thing that's sort of not new, as I talked about this last year, is looking at the evolution of shape. And I agree with that blink philosophy, is just looking at the whole idea of how facial shape changes over time and how we respond to people and how we acknowledge or recognize aging. We're going to talk about fat over the long run and see what happens with fat over time. And then we're going to talk about a couple specific areas that I've been focused on thinking about that I want to address with you, which is the buccal area and the chin. And then just really thinking about some long-term safety issues, listening to a lot of speakers in the last few years as well. And so we have to ask ourselves, what defines youth? And we oftentimes look toward an answer which involves the classic wrinkles, gravity folds. You've heard that for the last couple of days. And you heard Mark suggest that there's something more fundamental. And that's something that we see even at 10 feet away, and that's shape. And what is the shape that we recognize as we start seeing people evolve over time? When we see a child, it's a full circle. And as we continue, there's still a lot of baby fat in the teenage years, and so there's still a circular quality, even if they are very thin. As we continue into the early 20s, it's also very circular. And as we start moving forward from that into the mid-20s, into the late 20s, we start to see that heart-shaped face, that triangle start to appear through the circle. And so nothing's really an abrupt transition. As we get into the late 20s, we start seeing the triangle show up more dominantly with a little bit of baby fat still residual there. And most women tend to like a little bit of a leaner look, more of a triangular look, and that is something that occurs usually in the early 30s. As we proceed forward, there's a masculinizing quality that occurs to the face, as you heard earlier, and what that is really just a flattening of the upper face and beginning to dominate in the lower outer face, and so there's a squaring effect. As we continue forward with that, there is a reversal of the triangle where you start to see the lower face start to dominate, and as we gain weight and the metabolism starts to slow down, that becomes a part of the aging process. And then really what happens as we really mature forward beyond that is significant periorbital hollow with dominance of the lower face. So the question you have to ask yourself, if this is the issue, if we're already losing volume around the eyes and there's deflation, what are we doing to expose that periorbital hollow with further traditional reductive types of surgery? We need to put that volume back in. So the idea is to really flip the triangle back to a heart-shaped face. So let's talk about evolution of volume, long-term safety. We always talk about fat grafting not lasting. What does fat grafting do over time? Why are there so many people doing touch-ups? And we want to talk about looking at this whole long-term evolution. Something that I've seen clinically that actually Mark and Rob have done an amazing study looking actually computer modeling, and I think it's brilliant, is just looking at the fact that there is this evolution now confirmed using unequivocal computers. And what I want to talk about is what should you expect with fat grafting over the long run? Is it just going to be a steady growth? Is it going to be a steady decline? It's actually a combination of both. And I do a lot of hair restoration in my practice, and so I use that as a model of thinking. And I want to talk about using that for a way for you to really visualize how I see this dip in growth of fat grafting over time. You also, because of this, because there's growth actually over time, not a dissolution of your results, you really want to be careful with early touch-ups and overfilling. So be careful, and I'm going to show you that evolution. I think it's going to be much clearer when I show you these photos. Let's talk about the hair transplant model. This is from Walter Unger's 4th edition textbook on hair transplantation. And during the early phases of your result, the fat is getting nourishment from the surrounding tissues through a process called primary and secondary inosculation, almost the way that tree branches unify when they're placed close together. And it is not until about 6 months that normal vascularization under histologic examination occurs. And I think at that point, at 6 months, when you get the plug-in, when you actually get the plug-in of the blood supply, your fat actually starts to grow in shape. So you really want to look at this as a moving target. So you don't want to go in there and do an early fill. I think it's really interesting to look at this model of 2 types of free grafts to understand this. So what is this? What's happening here? The line that you see is the preoperative volume that goes across. Right afterwards, you get edema. You get a nice look to the face after the initial scariness comes down in about 1 or 2 weeks. In about 4 to 6 weeks, the patient's still quite happy. Also, some of the wrinkles have been effaced through the swelling. But over time, sometimes, in about 20 or 30% of your patients, at 3 months, you actually get a dramatic dip where the result actually looks quite disappointing, to the point where it actually could be almost to preoperative values. And that was borne out through Mark and Rob's study using a computer modeling. And then the result actually starts to improve somewhere at the 6-month juncture up to about 18 months to 2 years. And so I want to show that to you using sort of photographs of patients. I photograph my patients every time they come through. This is a 40-year-old lady, and if you look at her, this is 1 week out. She actually looks pretty good. A little bit of swelling, a little bruising, but there's a very swollen, soft, youthful look, maybe too robust for her taste, but that's just swelling. As we continue with this, I didn't see her, except for these intervals. I'll show you a little bit more shorter intervals in a moment. But at 3 months, this is pretty unimpressive. It's to the point where it's only slightly better than the preoperative view, very, very moderately there. And then I saw her back a little over a year out, and the volumes have just come back. And I really believe that when I see her back at 2 years, she's going to look better than this. And the key with this is I think some people that have talked about problems happening about 2, 3, or 4 years post are the individuals constantly trying to touch it up on the early end. So I would advise you to be very careful with the early touch-up and look toward the evolution of long-term changes. Here's a lady that at a month looks pretty good. Some of that honeymoon swelling is still there. There's a nice shape to the face. And then if you look at her at 3 months, she actually is one of those 70 or 80% that I don't think really dramatically dipped. Still looks quite good. You know, it's not a perfect result, but nothing is perfect. And interestingly enough, she was actually on Accutane before, about 6 months prior, but because this procedure doesn't require any cutting per se, you can safely do this in someone that was recently on Accutane. Now, as you proceed forward with this is 9 months out, and you know, maybe now it doesn't even look as good as 3 months. But there's a blending that occurs at a year now that just looks a little bit softer, a little bit more blended. There's more light reflexes over the whole face, more continuity. We're going to talk about that more. And then about 2 years out, and this is with no makeup, really just an incredible balancing. The skin looks better, and we're going to address some of those issues toward the end of this talk. So there's this evolution of change that's very interesting. These are all one session of fat. I rarely do a touch-up. This is a 1 week result for a gentleman, very, very swollen looking, some bruising. And at a month, I think the result looks pretty good. There's a little bit of hollowness here or there, but as you heard from Mark, you want to keep those volumes relatively suppressed in a gentleman. But as we continue at about 3 months, he has a dip to the point where it's only modestly improved compared to the preoperative photograph. As we continue forward with this, at 6 months, you can see it's a little bit better. There's a little bit better improvement in the texture and tone, I mean not texture tone, but the quality of blending of the face. As we proceed forward to 9 months, it's a little bit better. And as we go toward a year, you can see that's even better. There's a better shape, and you can see that this is part of the artistry of looking at a face and really keeping restraint on the volumes and shaping a face to be more square in a gentleman, as you heard before, to be more masculine rather than feminine. This is a lady here that is a week out, a little bit too overfilled, a little bit too swollen looking, and that's very normal at a week to the point of distortion and not looking attractive. At a month, the swelling is still there, and she looks pretty good, but there's a little bit of rim of distortion if you look at her face, but it's still a nice result because some of the wrinkles are gone. It still looks good. And I actually didn't see her through the dip phase. She lives from out of town. She just comes in periodically, but at 9 months, there's a nice facial shape. All these are, by the way, only fat grafting. I'll tell you if I've done other adjunctive procedures. These are just simple full-face fat transfer with no other adjunctive procedures. And then at 2 years out, I did do her lips. I did a little silicone lip enhancement. But this is 2 years out, and you can see a really nice facial shape that's actually better at 2 years than it was possibly even at 9 months or at 1 month. We're going to talk a little bit about the buccal region. And what some of my thinking about the buccal area is really we talk a lot about mid-face enhancement, upper face enhancement, lower face enhancement, but there's a watershed zone that unifies the mid-face and the lower face. We talk about cheek, 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 jawline, jawline, but how about that unification of those two areas? Remember that what fat grafting does is almost like airbrush work. It unifies the face. It's almost blending the zones. So when I look at fat grafting, you want to look at the target zones for rejuvenation, but you also want to be able to blend in the areas that are not there. And so instead of buccal fat extraction, which has been so commonly talked about, it's the exact opposite. It's putting fat back in the buccal area. And I divide it down into 3 areas, into the medial area, which is really where we lose a lot of dentition. The canine fossa is an extension of that, so this sinking into the medial area. The central area, which is where we all lose a little bit, and that's the major target of focus. And then some people that are very gaunt laterally, you want to go and widen that face to create a little more aesthetic balance, and that's at the backfill area that lies somewhere underneath the zygomatic arch. So this is just a little illustration showing you the subdivisions in the buccal area and the refinement of the concept of the buccal area. And this is just showing you the central buccal area. This is the lateral buccal area, and actually it does tilt almost 90 degrees back to go underneath the bone. You can see the arrows where I'm trying to show you that. And then this is the medial area, the area right across here. The only caveat you want to express to the patient when you fill the medial area is it does worsen for about 2 to 4 weeks, this area right around the mouth, the labiomandibular sulcus, and that can look not so good in the short run. This is a lady that I did plasma resurfacing on, a little bit of upper eyelid bleph, and I did fat transfer on. And this is really looking at the center. Didn't really go too far out, just really focusing toward the central area. You could argue to go a little bit further out. I was really focused not to widen the face too much on her. The lady you saw earlier was a more extensive buccal area, and if you ask me what's the most important area for me to work on, you may say, oh, we'll work on the eyes. But I really believe if I had to put a little Restylane in, for example, the area I would focus on is in the buccal area. That is what ages her the most. So I did a backfill central area and then toward the dentition in the medial aspect. And I think if you can blend that area, you create a more unified face. This is my own mom, and with Asians you tend to have a very heavy lower face, so you want to pull the anterior chin and the upper cheek area forward, and you want to stay very clear of the medial area. I put probably about a half a cc in the buccal area just to transition. It was only the central area, but very minimal buccal fill. This is a young lady, only 39, little Botox, lip enhancement, a little bit of plasma resurfacing to clean up the skin, and then this is another 3-part fill where the back fill, the central area, and the medial area are hollow. So even for a younger lady, I think you just got to look for all the zones that need to be filled. There's a lady here that if you look, she has a sort of a pushy quality to the medial aspect with a little bit of exaggeration of the hollow underneath the arch. So this is a little bit extension out to the outer portion of the buccal area, but being very careful because she's got a somewhat wider face. So it's a little bit central, a little bit less toward the outer portion, and then staying clear of the medial buccal area. And she also had an upper bleph. She also had a lower eyelid bleph, transconjunctival. She also had plasma skin resurfacing, and you can see that. I think this is a better frame to the face frame to the eye that we talked about. This is no facelift or brow lift or anything like that. Keeping the brows low and full and balanced, I think, creates a younger look. Let's talk about the lower face. We heard a little bit about the pre-jowl area. I want to focus specifically on a concept here which I think it helps you conceptualize as better, which is the upside down U. Looking at this as a continuous area of hollow that arches all the way across. And oftentimes, we're very focused on the jowl and the labiomandibular sulcus as the issues, but perhaps we should be looking at something else. When I see an aging chin, what I see is a central bone island sticking out, and what I try to do is blend and soften around it to join it with the surrounding areas. So it's almost like when you see the vase of a woman, a vase with the side profile of a woman, what are you looking at? This is the same thing. I'm looking at the hollow instead of looking at the fold and the jowl. So it's just a little bit of rethinking and refocusing on what I think is important. So it's just filling in not only the pre-jowl area, but really focusing on the anterior chin, not so much the line or the fold, and not so much on the jowl, but just this whole continuous zone. So this is just showing you filling the pre-jowl area you saw before, and then filling the anterior chin area, and blending that whole area as one arc. There's a lady here that actually looks thinner after fat grafting because I was able to bring the anterior chin forward and the cheek forward, but also what I've done is really soften that upside down U and blended it in with the surrounding areas. This is no facelift, liposuction, or anything else. Here's a lady that's on the left had the brow lift, the eyelid surgery, and the facelift, and she's 55 and really not rejuvenated. She needed the blending of volume in all the right places. And you can see that anterior hollow that sits there. It's not just a mental sulcus, it's the bone exposure that is apparent circumferentially around the chin area. Let's talk about stem cells. We heard a lot about that. I think it's a very interesting concept. Again, I like to use the hair transplant model. I was in Montreal a couple weeks ago for the ISHRS, International Society of Hair Restoration Surgery, some really interesting concepts have been developing about the interaction of the recipient site to what you graft over there. For example, if you have a scarring alopecia like lupus, discoid lupus, and you transplant hairs into that area, you actually start to soften the scar, and it looks normal over time. To me, that's really exciting information. So I think there's something about the transplant model of putting a graft in there and the effect that it has locally. I've seen some scar reduction, pigment changes. I had a lady that went back to California and to see her family, and the family didn't even notice my fat grafting, except what I worked for 3 years on, brown spots, finally faded just with the fat grafting. Now obviously you want to be really careful of making these comments because they're not necessarily consistent changes, but they're interesting changes. You don't want to offer this to a prospective patient as a promise or a guarantee, but just interesting concepts for you to observe as you mature and continue with fat transfer. This is a 55-year-old Korean lady who wanted to come in for facial rejuvenation and acne scars. And I decided just to do the fat grafting because, you know, dermabrasion, fillers, things like that, other things that would require some downtime for an Asian, I just thought, let's put some fat in there. And this is about 9 months out. I actually haven't seen her back, but it's a really nice change to that texture and tone of the skin. And I'm just really excited about this. This is a charity case I did for a lady that was in a car accident. And what was really exciting is this is the same room, same lighting, same distance, but there's just better texture overall. And the scar that she's undergone multiple scar revisions for that's become atrophic has really softened by 80%. It's not perfect, and this is about a year out. I'm really curious to see her 2 years out. In fact, when I did this procedure, she had so much scar tissue that my cannula almost broke. It was so difficult. I thought her fat take would be 0. But out of this, even in this circumstance, I think it's a nice textural change. Maybe that's where she got most of her benefit. Long-term safety, I just want to emphasize one more time, I think the focus of what you can get out of this talk is be careful of overfilling and be careful of the early touch-up. I think there's an evolution to the change of the result that you want to be wary of. And one more thing that I learned from Val Lambros is really just being careful of thinking of using this as a reconstructive modality, because sometimes if you've got a deficient mandible and you put fat in there, because there's an evolving shape change, this can actually be larger over time and grow to distortion. So I usually, if there's minor asymmetries, I may go and just feather a little bit more. But generally speaking, I keep pretty symmetric volumes on almost everything that I do because fat is not a bio-inert substance, it's a live graft, and that's something you need to understand that. So I appreciate your attention.